Hello, my name is Sian and I'm a consultant nurse in child health at Aneurin Bevan University Health Board in Wales. My background is in community children's nursing, supporting children with complex health needs, which includes supporting families of children who are enterally tube fed. About 5 years ago, we were made aware that a parent had been administering blended diet via the enteral tube as an alternative to the commercial feed prescribed by her dietitian. A blended diet is when home-cooked food is blended to a smooth consistency and administered via the feeding tube. At the time, there was a lack of professional consensus in relation to the benefits of blended diet due to the limited clinical evidence. Blended tube feeding was fairly new in the UK, but it had been in place in the States for a number of years. My clinical and academic interest grew as I was keen to develop the evidence to inform clinical practice. Having conducted a research study in Wales, exploring the risks and benefits of the practice, I was keen to explore international practice and was successful in obtaining the Florence Nightingale Travel Scholarship to explore the use of blended diets to children in the US. For my travel scholarship, I spent nearly 3 weeks in America and visited 2 of the leading children's hospitals, as well as meeting senior personnel of the 2 leading pre-packaged real food blends that are on the market in the States. It was a great opportunity and experience. It's really difficult to consolidate all the learning in a couple of slides, but the standout moments for me was the opportunity to visit the lead children's hospitals and pioneers in the field. It was inspiring to meet the team at Seattle Children's Hospital to hear of their trailblazing work from the development of standardized blended diet recipes based on clinical need, the process of making the feed in-house, as well as the sophisticated nutritional monitoring and the recording of the feeds via the electronic health record. I then moved on to Boston. It was really interesting to see how the gastroenterology and respiratory team worked together within the aerodigestive center and how the blended tube feeding was making a difference to the health outcomes of these patients. A key learning for me here was how we can use the IDSI tool, which is a dysphagia tool, as a measure of feed thickness, and use this as part of patient education and clinical review. It helps us to standardize education for families. And finally, even though the commercial blended feeds are not currently manufactured or widely available in the UK, it was really interesting to meet personnel within these companies to understand the background to the development, the research that they're undertaking, and the company's future plans. On my return, I was really keen to share what I learned with my clinical networks, the clinical team that I work with in my health board, the pediatric gastroenterology network, which includes pediatricians, nurses and dietitians in South Wales, and the blended diet advisory group, where I'm the nurse representative working with lead dietitians across the UK. So locally, having shared my experience with my team, we agreed some changes in practice which were implemented through the revision of our blended diet protocol. Previously, the protocol was only for the community setting, but this has now been extended to all care settings, which includes inpatient care. Additionally, we've also revised and improved the quality of our patient and staff education material. And nationally, having shared what I'd learned regarding blended diet practice in the US with my colleagues on the National Advisory Board, this has helped guide our thinking and helped inform the national guidance for blended diet practice in the UK. The impact of the travel scholarship has been wide-reaching. The main reason to undertake a travel scholarship is to widen your knowledge base in order to inform clinical practice, and I'm delighted that since my return, along with my colleagues in the health board and nationally through the blended diet advisory group, that the knowledge gained through my travels has informed practice and made a positive difference to patient care. I've really valued the opportunity that was given to me through the scholarship, and within a few days of returning shared my experience with senior nurse and midwifery leaders, the outcome of which is the commitment to grow, support and mentor future scholars. And finally, the impact on me personally. It's been really enriching and rewarding. I've widened my network and community of practice internationally. It's been an invaluable experience that I would recommend to all my nursing colleagues. And finally, I'd like to take this opportunity to thank my sponsors, the James Tudor Foundation and the RCN Foundation, as without their financial support, it would not have been possible. And also, I'd like to thank the support of my Executive Nurse Director and colleagues within Aneurin Bevan University Health Board. I'm truly grateful for your support and your encouragement.